Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love.
That is what depression does. It overpowers you. It takes the wheel and it steers you away from everyone and everything you love. And it takes you down a dark tunnel. And when you're in that tunnel, it hugs you and it tells you that this is where you're supposed to belong.
When we look at the brain of a depressed person, studies show that the hippocampus tends to be much smaller than average. Other areas of the brain are also physically affected, but this region in particular controls memory and emotion. And the longer a person has been depressed, the smaller the hippocampus becomes. The cells and networks literally deteriorate. It turns out that stress may actually be a main trigger in the decrease of new neurons in this area of the brain. In fact, studies have shown that when this region of the brain is regenerated and new neurons are stimulated, mood improves.
Some of the major emotional symptoms include deep feelings of sadness, reduced interest in previously enjoyed activities, low sexual desire, restlessness, feelings of worthlessness, constant irritability, social withdrawal, and recurrent thoughts of suicide. There are also many physiological symptoms associated with depression. Some of the most prevalent include unintentional weight loss, insomnia, loss of energy, and even slowed movement or speech. Depression can really affect you in the long run. Behavior caused by depression can cause a downfall in a student's academic abilities, disrupt meaningful relationships with loved ones, and lead to malnutrition. Therefore, it is very important to seek treatment. Major depressive disorder can result from a number of things, especially for a student. It is likely due to a complex combination of factors including genetics. People who have first-degree relatives who also undergo depression are at a higher risk themselves. Personal life events, tragic events such as the death of a family member, loss of a job, divorce, or any other type of stressful occurrence can increase chances of depression. Traumatic childhood, sexual or psychological abuse, neglect, poverty, and an unhealthy lifestyle are a predisposition to developing depression later on in life. There are different ways to treat depression, depending on the severity of the disorder and other circumstances. First off, there are several antidepressant medications that act upon different neurotransmitters in the body. Selective serotonin reuptake inhibitor, or SSRI, is an example of a drug that increases the amount of serotonin in the brain, which is a neurotransmitter associated with happiness. Although there are many drugs that can be obtained to eliminate depressive symptoms, it is not a long-term solution. Cognitive behavioral therapy, CBT, and interpersonal psychotherapy are the 2 main types of therapies used to treat depression. They help individuals focus on the present and encourage the regaining of control over mood and function. However, the best solution is to have support from loved ones to help alleviate feelings of depression. For example, having a sit-down talk with family members to discuss practical solutions to ongoing problems can reduce symptoms of depression.
Depression is both a brain disorder and a state of mind. It is the primary reason why someone dies of suicide about every 12 minutes, over 41,000 people a year. In the U.S., it affects over 18 million adults in any given year, causes 490 million disability days from work each year in the U.S. If you have depression or have suicidal thoughts, then please reach out or talk to someone.